Welcome to the Growth Mode podcast, where real conversations fuel real business growth. Hosted by Nina Labbe, media strategist with Salem Surround. Get ready to listen, learn, and grow. This is Growth Mode.
That pain doesn't just hurt your body, it can hold your entire life back. Today on Growth Mode, we're talking to someone who's changing that. Dr. Frank Kuwamura III, founder of MD Spine Care. In this episode, we'll dive into his journey from practicing physician to growing a multi-location medical practice here in San Antonio. We'll cover how he's embraced innovation, what it takes to scale without sacrificing care, and how patient trust fuels his business growth. Whether you're in healthcare or any industry, this conversation will inspire you to lead with purpose and grow with vision. Joining me today is Dr. Kuwamura of MD Spine Care, a multi-location practice here in San Antonio known for helping patients regain control of their lives through innovative spine and pain management solutions. Dr. Kuwamura.
Oh, gosh. Thank you so much, Nina, for allowing me to visit with you and just tell little things of what we do.
Absolutely. Thank you so much for being a guest on Growth Mode. I'm so looking forward to this conversation.
I've been looking forward to this ever since, I saw it on my calendar.
Yay. Awesome. Okay, so now we got to start with your story. What inspired you to launch MD Spine Care, and what gap did you see in the healthcare industry that you wanted to fill?
It's really what prompted me to start MD Spine Care was a vision. Mm-hmm. The vision was looking at, and it's from two perspectives, one being a doctor-provider and one also being a patient. I'm a patient that suffers with many of the ailments my patients come to see me with. Mm-hmm. So I saw a need, and I saw a need to provide our patients here in San Antonio a different solution. Mm-hmm. A different solution than I experienced, and I saw many of my patient solutions. It's really looking at the patients in total. Not just, I have a broken arm, mm-hmm. I have a bad knee, I have a bad back, but really more about that patient. How healthy are you? Mm-hmm. What are your habits? What's your nutrition? So my vision was to help the patients. And number one, it's always about the patient. Mm-hmm. Number two, the vision really from our business standpoint was to try to develop a system that we could elevate our care here and be an example for other providers to start, as I early in my career, thinking about outside the box.
Okay. All right. I noticed on your site, you now have 7 locations.
We do.
That's impressive growth. What was your vision when you first started, and how has it evolved?
The vision when it first started was really to provide the best care we can. And we have a saying in our company is our motto every day is that we don't treat patients, we change lives. Mm-hmm. That's our mission statement. To do that, though, I knew that I had to reach out to as many people to try to help them as I could, hence opening more clinics. But to do that, I am blessed in the fact that, I have outstanding people. You can't do that. I can't do that. I need outstanding people to help me. And I'm really proud of all my staff members, all my clinicians, my administration people that see that same vision of treating that patient, not just as a patient, but are you like they're their friend or family member.
I love that. Your website also mentions cutting-edge, non-surgical treatment options, which really caught my attention. What are some of the most exciting advancements that you've adopted?
There have been some amazing. So my background was, before I wanted to be a physician, I wanted to be a researcher. And I went to Boston. I was in Boston for a while doing research on regenerative things like regenerative cells and viruses and bacteria. Mm-hmm. So one of the advancements we're seeing is in a couple things. The foundation of our health is really nutrition. So we're seeing a lot of strides with nutrition. We're with weight loss. We're seeing with exercise, with how our mind and spirit come together to help patients either recover from an injury or, better yet, to stay healthy. So we're seeing that. Some of the advancements we're seeing now are in some of the things that we can do on the clinical side, injectable things, such as there's peptides. As we all know, there's weight loss medications like the GLP-1s. We're seeing a whole shift of patients getting healthier.
Yeah, I'm hearing a lot about peptides these days.
Right.
Okay, wonderful. So what sets MD Spine Care apart from other practices in the region when it comes to patient care?
Well, I think that, number one, in San Antonio, we're blessed. My colleagues in San Antonio are amazing doctors and practices. We're really blessed here with the care that we give our patients. What I think is different from us is that we look at patients and we try to patients, not as me as a trained surgeon or an orthopedic surgeon or a spine surgeon, but I'll talk to you about tell me about your day. Tell me about what you're eating. Tell me what you're doing. Are you exercising the right way? And we dive into the other parts. So I think the difference is really that, number one, we maximize your health. Many of our success stories are patients that come to me for surgical problems. By changing the foundation of their health, their nutrition, their exercise, they avoid surgery. They get better.
Wow. Now those questions I wouldn't have even thought would be on the radar. Like, what are you eating? If I'm coming in for a neck problem, I would have never even thought of that.
We're learning more about the body, and the scope of what we're learning, I'm trying to encompass in our practice. In my education has grown over the years, going from a traditional doctor to some of my backgrounds. One of my uncles was an acupuncturist. So he kind of showed me this glimmer of this other side of things I wasn't taught at medical school. Yeah. And it opened my knowledge and thirst to learn more. So we are learning, and what's happening is our patients are benefiting.
Yeah. Well, and it makes sense because it's like connecting the dots, right? Everything's connected, right?
We are.
So it makes sense, I guess, now that I think about it, to ask that question, to ask all those questions. All right, so let's talk a little bit about growth. Expanding to 7 locations takes more than great medicine. It takes a growth mindset. What key strategies have helped you scale successfully? One
of the things that helped us grow was I knew we had to grow from within. So in all our locations, number one, we looked at from a business, where are areas where we aren't helping patients and reaching out to them. So first of all, we have a team that looks at that. Where are some patients or populations of patients that can benefit from what we offer? That's the first thing, identifying the need. But internally, we have to develop the culture to reach out. And that involves, my administrators and my team, selecting the right people to join our team. Because really our team together. It's a company, but we're more team together with a vision to help people. So we have to build an internal structure to then reach out.
I love that. It's one team working towards one goal, one vision. It's like once you have everybody together, it's like you're in lockstep. So that's amazing. So as you grow, how do you maintain a consistent patient experience across all your clinics?
It really has to do with, number one, again, I'm blessed with the people that provide the care. They're just outstanding people. All the providers we have in our practice, I would send no hesitation, a family member, a friend, an acquaintance. I don't think you can do better. The other thing, and this is a process that I thought was really important early on, we have what's called a morning meeting every single morning. So we utilize technology to do that. We use a Zoom meeting, which we all use, but we have location A and B and C, and everyone's participating. And we go through, what does our day look like? Are there patients that we call TLC patients coming in? So the whole team, not just maybe the team that's going to see the patient today, but the rest of the company knows, you know what? our Stone Oak location is going to see a patient that really needs some extra TLC. So it's again building that team effort. It's building, hey, location over on the south side. Do you need some help today? Or tell me about what's happening with your patients. And it's really driven. That's part of our meetings every morning. The other is education. Like today we're starting a series that does educations on peptides. We're talking about what are peptides, how do they help our patients, and giving our practitioners more knowledge.
I know I would love to learn more about peptides just because I keep hearing it so much. I mean, it's like there's probably so many that treat different things.
They're amazing, and yes, and peptides is just one thing. PRP was a discussion earlier in the week, and all these are, and they're educating our staff member from the front desk person that greets our patient to our administrative staff that may never actually see the patient, but we're working on the administrative side, and of course our clinicians.
Right. Okay. All right. Let's talk a little bit about marketing and community visibility.
Sure.
What role has marketing played in helping you grow and reach new patients?
I think it's crucial. I think that the days of a practitioner of having a brick and mortar shop, providing outstanding care, providing being the best doctor that they can be is fantastic. Yeah. In today's world, I think that's not survivable. And again, some of the things in our vision is to survive in this market, and that's the business side. There's so many pressures now on medical practices that weren't there 25 years ago when I first came back to San Antonio. We've changed. How you have to change is you have to adopt technology, you have to embrace it, you have to learn it. And marketing, whether it's reaching out to the community, which we've done for the longest time, or utilizing social media, or utilizing other avenues to reach out, tell your message, educate the patients, which is what we love to do. Yeah,
I love that. It's important to be constantly evolving. So do you feel, speaking of evolving, do you feel digital marketing has been more effective than traditional marketing for your practice, or has it been a balance of both?
It's, we've had digital marketing is amazing in the fact that we can go and utilize the tools of digital marketing with campaigns, right? Hey, and it's a message. Hey, this is our message that we're trying to reach in a target audience. We've had some campaigns that have been, there's goods and bads. We've had some campaigns that are very successful. One of the things that campaign that was really successful for us was an artificial disc campaign and utilizing digital marketing. I was the first person in San Antonio to perform an artificial disc replacement. Years later, we had the ability to replace people's discs in the neck that are injured and diseased with a mechanical disc. We engaged in a digital marketing campaign that was covered from just south of Dallas, all through Texas, south of that to the valley. The efforts of that were amazing. We were getting phone calls, patient visits. So, yes. Does it work? Yes. Sometimes it doesn't work, though.
Right. Okay. I got you. Speaking of your audience, who would be your audience?
Well, a few different people. If you think about subsets of patients that will see us, will be traditional patients that have musculoskeletal needs, whether it's an injury or an ailment or a problem they're suffering with. That's one population. The other population of patients are they're seeing where they are in life and they want to get better. They're trying, and what we're talking about now is not maintaining health, but maximizing health. Okay. Taking you to the next level. The third part probably are patients that are coming for second opinions. They've seen really good doctors and they're saying, hey, is there another alternative to what I was told?
Okay. All right. Awesome. So how important is patient education in your marketing efforts or community outreach?
Well, two things. Education is crucial. I mean, we've developed and we continue to develop videos. I think videos are great. I'm a visual learner. I'm a visual auditory learner. And I see that as a really powerful tool. So we've developed patient education videos internally. And so we can, if I talk to you about a process or a procedure or something, in our offices now, I can show you a video that we've created about your particular problem. That's our first stage of what we're developing. Our next stage is really is taking those videos and casting them out to any patient that wants to learn about it. So I think our website, our video content that we produce is extremely important for, number one, education, and number two is delivering the message that we want to deliver.
Right. Okay. Awesome. And make sure you go to his YouTube channel because I've seen the videos and they are very educational.
Oh, thank you.
Yes.
Yes, we're going to be starting those again.
Yay. Awesome. I always love to get educated. All right. So let's talk a little bit about leadership and legacy. As a physician owner, how do you balance business leadership with patient care?
It's hard. It really was hard. And again, I can't do it without support staff. I really need. Today I'm blessed. Today is Friday for us. And I'm able to come and talk to you and develop this part of the practice and spend time on the administrative and reaching out to community. I couldn't do that if I didn't have amazing people seeing the patients back in the practice.
Right. Right, absolutely. You got to have a team. It helps to have a team, right? Yes. Okay. So what do you hope MD Spine Care will be known for, say, 5 or 10 years from now?
Our vision is huge. We have a huge vision. So what would I like to say, either legacy or what we're trying to develop to be known for, is the cutting edge, right? We have great care, but what's better? We've always asked those questions. What can I do better? Whether it's a surgeon or a practitioner or a guidance, someone that guides someone through health, what can I do better? And we're in the stage of some development of things that I think are really cutting edge, of things that we're going to hopefully be able to develop to provide better care. So what MD Spine Care is trying to do, we're trying to elevate the level of care.
Are you able to give us a sneak peek on what some of those cutting edge innovations that you're talking about?
I can. I think so. One of the things that we're in the midst of developing, and we're in the midst of starting to take it to the next level. Are some things of 3D printing. Again, think about learning. And so if you came to me with a knee injury or some type of problem, conceptually, I can describe things, I can show things to you, I can talk to you about a picture, what an MRI looks like or an X-ray looks like. Well, we're going to take you to the next level. We're going to be able to give you or your doctor or anyone else a 3D printed image of what your injury looks like. So that helps helps you with understanding. So that's an educational. The other part of and that's on our wellness side, we're looking at virtual reality and augmented reality, which is something we've been involved with for many years, and trying to change your experience, not in the metaverse, in the area where we can start educating and having you feel things and learn things, and also for your health improve through this technology.
Amazing. I love that. Awesome. All right. So before we wrap up, what advice would you give other physicians or healthcare providers who are thinking about growing their own private practice?
This is one of the toughest, as I've evolved in my practice over the number of years. I think the best advice I can give another doctor is to be open-minded. Open-minded to, yes, you are probably the best person that does your craft, your doctor. Unfortunately, the economics of medicine has changed dramatically. We have large hospital groups, we have insurance companies that, in essence, I'm a sole practitioner. That's extremely hard to do with economic pressures. The goal is to diversify what you offer a patient. You may be a surgeon, you may be a primary care doctor, but if you diversify for the benefit of the patient, of course, then you're looking at ability to survive in this economic market.
Okay, wonderful. All right. Okay, so is there a patient story or a moment that reminds you why you do this work?
Boy, I think, there are so many stories. We're blessed all the time, patients coming up and thanking us, again, for what? Changing their lives. One of the stories I think I'd like to share would be, I saw a patient that was a midwife delivering babies. She had a significant injury to her neck, and unfortunately, because of that injury, she was very fearful of losing function of her hands, tingling, numbness, an inability to safely deliver babies. Okay. So subsequently, she lost her job. She lost her insurance. So she came to see us in MD Spine Care. Well, we saw her, and we were able to provide her cutting-edge surgery to take away her diseased disc in her neck and to replace it with an artificial disc. We have, and to do that at no cost to her. And so it was a reach out to someone in need. And what did that mean? Within 3 weeks, she went back to work. She got her job back. She was able to provide for her family. So, wow. Those are just things that we do, we do to take care of people.
Gosh, I love that story. How about one more story to share? It's so inspiring.
Well, there's a gentleman who's we're going to actually make him one of our poster children for the our wellness side. He came to us really down. He works as a mechanic and hardworking man, and he owns his own mechanic shop. A hardworking guy for many years, has really beaten down his body. Wasn't taking good care of his health, remember, and came to us for a second opinion. And other doctors had rightfully said, hey, the surgical solution to your problem is to do this massive surgery. Which is true. That's not untrue. When we looked at him, we said, well, wait a second here. How about if I make you healthy? How about if I help you with your journey towards being better, losing weight, exercising, eating nutrition, maybe taking some supplements to support you. And then once you get healthier, let's make a decision down the road. He's lost probably, I think at the latest toll, close to 95 pounds.
Wow. He
says, you know what, Doc, thank you so much, but I don't want to have surgery anymore. My pain level has gone from a 9 to a 2. Wow. I can live with a 2. I'm going back to the shop. I'm working again. So what a story. Someone who was facing, and the other opinions were correct. They were right. But they didn't look outside the box. They didn't look at the patient in total.
So what you're saying is the weight caused the pain.
The weight was a factor of problems, right? His pain, it was pain. His pain was horrible. It caused him to live a different lifestyle, not be as active. The weight was one factor we worked on for him. There was many things we worked on, but weight didn't cause the pain. But in his body, carrying the extra weight was really hurting him.
Yeah. Wow. Okay. Thank you for sharing those stories with us. All right. So if someone wants to learn more about you, where can they go?
Well, of course, search us online, right? MD Spine Care, our website. Come see us just for a visit. Okay. We consult other practices and doctors, and certainly I do that without question. There's a practitioner I'm guiding right now in Corpus that's thinking about taking the pathway of continuing the autonomy of private practice, which is a blessing, but also surviving in today's economic market.
All right. Well, that about wraps it up. Dr. Kuwamura, thank you so much for sharing your time, your insights, and the incredible work that you're doing at MD Spine Care. It's been such a pleasure having you on.
It's been so nice to be here with you.
Thank you. Awesome. And if you're listening and this sparked ideas about how your own business or practice can grow, stick around for a few final thoughts. If you're a business owner or a healthcare leader thinking about growth, I hope you found this episode as motivating as I did. If you'd like to learn more about MD Spine Care, be sure to visit mdspinecare.com. And if you're curious how your practice or business could gain more visibility, I'm offering a free marketing strategy session. We'll take a look at where you are and how you can grow grow, whether it's through SEO, digital ads, or getting found locally. No pressure, just real solutions tailored to your goals. You can reach me at growthmode@salemsurround.com, or you can call me directly at 210-526-3626. Let's connect. And don't forget, you can find Growth Mode on 930amtheanswer.com, YouTube, Spotify, or wherever you get your podcasts. If you enjoyed today's show, make sure to give it a like, a comment, subscribe it, and share it with your network. Until next time, keep growing forward.
Thanks for listening to the Growth Mode podcast with Nina Labbe. Stay connected, keep learning, and keep growing. Don't forget to like, subscribe, and share. And we'll see you next time on Growth Mode.
Want to grow your business online and on the air? Right now, when you sign up for a 6-month organic SEO campaign at $3,100 a month, we'll include a free radio schedule, 1 week per month for 6 months to help kickstart your visibility. That's a $5,000 value in radio advertising, designed to drive awareness and leads from day one. Don't miss it. Email Nina Labbe at growthmode@salemsurround.com or call 210-526-3626 to learn more.